head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back. It's Dr. Lederman. You're welcome to call in. We operate a private cancer treatment center. There's no kickbacks, no drug companies, no surgeons. We just try to provide the best possible cancer treatment for each patient, one at a time. We take our time. We'll talk about a 76-year-old black man who came to us with prostate cancer and unfortunately had treatment which was less than optimal. He went to the doctor. He was diagnosed in 2001 with prostate cancer, and they gave him hormone treatment only. Well, we know from the data, and again, there's the data out there, hormone treatment doesn't cure anybody with prostate cancer. So number one, he had hormone treatment. Yeah, temporarily his PSA went down, but then it came back up. So he was left impotent from it and gaining weight and no erections. And then a couple years later, the cancer came back. And then he went and he had standard radiation, even though he had a Gleason 7 cancer. Well, we know that Gleason is how the cancer looks under the microscope. Take two areas, give it a number from 1 to 5. So 1 + 1 = 2 is the best. 5 + 5 = 10, the worst. He had Gleason 7. He had standard radiation. Standard radiation has a 60% chance of success. If he had come to us in 2005, he would have had a 90% chance of success. So what happens? Well, it means that 30% of the men get stuck with recurrent cancer that didn't need to have recurrent cancer if he had better treatment. So now he's got pain. He walks with a crutch. The cancer's back. His PSA is up. We're going to try to remedy him, of course. He just came in a couple days ago, so we're going to try to remedy his situation. But this just tells you need to get the best treatment first. So look at the data. Again, we have a booklet with our data, and we urge you, if you have prostate cancer or prostate disease, to give us a call at 212-CHOICES. We promise to see you within one business day. Don't get bad treatment when you can have good treatment. By the way, another patient came with prostate cancer this week with a PSA very high risk, PSA Gleason 8, PSA 19, came to us for our treatment in the stereotactic frame and brachytherapy, and now his PSA is 0.59. He was treated last year, and his PSA is way down, doing well, feeling fine, carrying on in a very good way. And I'm going to talk about another man who was just approved for treatment. He had a Gleason 6 cancer, was seen at one of the big hospitals. He actually went for CyberKnife, if you can believe that one, even though there's no proven data and it's considered experimental. And luckily, they couldn't treat him because he had hip replacements. And CyberKnife takes a lot of X-rays, and it tries to set up the computers with X-rays, all these X-rays to the patient. Well, the hip replacement distorted their imaging, so they couldn't treat him. Luckily for him, because there's just a report out this week that says that genital urinary toxicity is more likely with CyberKnife treatment than with other radiation treatment. And this is an article written by Charlotte Bath, retrospective analysis of patients with prostate cancer receiving CyberKnife treatment found those receiving CyberKnife treatment had greater rates of genital urinary toxicity even 2 years after treatment. The increased toxicity, she writes, quote unquote, was present at all time points and indicated an increase in both acute and later toxicity. Period. This increase was largely associated with higher rates of urethritis, urethral strictures, urinary incontinence, and obstruction among patients receiving CyberKnife treatment. This is from Dr. James Yu at Yale School of Medicine and was published in the Journal of Clinical Oncology. Again, there's not long-term data. It's a technique that generates lots of money for the hospital and doctors, but is it best for the patient? We have a technology that's been out more than 20 years, been practicing it, treated patients. We have data out there. Here you've got a treatment without data. You wonder why some person would take a treatment without data. Doesn't make sense. And now you've got data at 2 years. They don't have long-term data about results, but they have long-term, short-term data, 2 years, showing increased toxicity compared to other methods of treatment. So you may want to stay away from that. And we had another woman who came in. I want to talk about her for just a minute. She's a 65-year-old woman, married, no children. She's had diabetes for 58 years. So as a child, 7-year-old, she had diabetes. She came with heart disease. She was really worried about her heart disease, her ejection fraction, which is how much the heart pumps. Most of us, it pumps about 65%. Whatever's in the heart pumps, and about 65% go out to the body. In her, it was pumping at 65%, except she had a stress test, and during stress, it went down to 45%. So she was really worried about her heart, but she was having a lot of pain. And in fact, she was worked up, and she was found to have breast cancer, and the cancer had spread to the bones. So she had stage 4 cancer with severe back pain and hip pain, and she was essentially bedridden. I saw her, came in the room, and she was laying on 2 chairs. Wow. We talked about her case. I examined her, got the documents. We staged her. So the first time she was staged, we found exactly where the cancer was. Remember, she had a mastectomy in 2012. So for the people who think mastectomy can cure you, think again. She had mastectomy in 2012, and now she's stage 4 cancer. We're treating her with radiation, and the pain is going away. We've got a caller on the line. It's almost into the hour. Good morning. How are you?
Good morning.
You're live on the radio.
Oh, I just was calling. I heard that there was 212 choices.
That's the number you called.
Yes, and you wanted the pamphlet about.
Right. If you want the booklet, just call us between Monday and Friday, 9 to 5 business hours, and we'll send that prostate booklet and a DVD to you directly. No charge.
Terrific. Thank you.
Thank you. God bless you. So for this woman with stage 4 cancer, she had the mastectomy, didn't work. She has stage 4 cancer now, terrible pain. We treated her with focused beam radiation in the stereotactic frame, so we're able to design a treatment just to hit the cancer, not hurt her healthy tissues. Supposed to have 5 treatments. After the second treatment, her pain was pretty much gone away. That's what we want. Good relief of pain, no side effects. She's up and around and exercising and building up her body for the first time in a long time. So that shows the potential of the work that we do. We're getting close to the end of the hour. How much time do we have, Bob? 50 seconds. So we're going to end up the show. We've got some news coming up with Therese Crowley. My name's Dr. Lederman. If you want those booklets and DVD, just call us at 212-CHOICES, which is 212-246-4237, 212-246-4237. We treat cancer. We're dedicated to treating cancer. We're a private cancer treatment center working for you, not others. So give us a call when you wish, and we promise to see you within one business day. If you wish, we take most insurances, Medicare, Medicaid. Thank you very much. God bless you, and have a great week.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 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 212